Sickle cell disease is the most common inherited blood disorder in the United States.
But South Carolina's specific data on it is limited. Mary Green has details on a new voluntary tool that state health leaders hope will change that and improve health outcomes.
Last year, the state legislature passed a bill to establish a sickle cell registry in South Carolina. DHEC is hoping to have it up and running later this year.
We're still in the development phase, but everything's moving quite rapidly, so my hope is sooner.
Sickle cell disease is a blood disorder that causes red blood cells to become misshapen and break down. This often results in excruciating pain and fatigue anywhere that blood flows in the body, and blocked blood flows can lead to strokes and infections. 1 in 400 Black Americans and 1 in 19,000 Latino Americans has sickle cell disease, while 1 in 12 Black Americans and 1 in 100 Latino Americans are carriers.
We know that the national data is there, but that state-specific data is just very limited.
DHEC is encouraging South Carolinians with sickle cell disease to register once it's up and running.
This would give us the opportunity to really look at health outcomes, health equity, access to care, and ensure individuals living with sickle cell have the services and resources they need to live healthy lives.
In addition to being voluntary, DHEC says the online registry will be secure. South Carolinians with sickle cell disease can voluntarily submit information, including their diagnosis, medications, and current treatment plan, and both they and their doctor will be able to access it.
And then the individual, should they need to seek care from a provider outside of their routine hematologist, they can actually share that information with that provider as well, who can validate it and hopefully treat them more timely and appropriately for sickle cell disease.
There's a similar voluntary registry at the national level, overseen by the Sickle Cell Disease Association of America. Reporting in Columbia, I'm Mary Green.
In 2016, a legislative study committee on sickle cell disease reported that there needed to be greater public awareness about the disease in South Carolina. It also found better education, including best medical practices, and more funding to improve access to health care programs was required too.